And then put your email address. It'll help Claudia.
Hey, Claudia, we will be recording this session for you.
Thank you.
I remember.
Much appreciated.
Actually, I made myself a reminder right next to the appointment to record the session.
Mm-hmm. Yeah, many times it happened to me. Like I plan on recording and end up forgetting.
If it's not my calendar, it doesn't get done. So.
Correct.
Most of the folks here. Looks like we have almost everybody. Should we wait about another minute here and then get started?
Looks like we have 4 people missing.
Okay, we'll see. Well, yeah, 3 or 4. Should we go ahead and get started? The others catch up if they will. Okay.
Sure.
Do you want to do any kind of an intro, Claudia, or just want me to get going? You're muted.
Sorry. Just a quick remark that if you have questions, it's okay to unmute yourself or put those in the chat. I think Fred probably would rather answer them in the end, but you let us know when would be the best time to answer.
But
I will keep.
if they have a question immediately, please feel free to break in. But I do
Okay.
have about 4 places
Good.
in there where I put in a slide for questions. So
Yeah.
if you can hold them till then, it just serves everybody a little bit better, I think.
Good. So if you have any questions that you want to drop in the chat, I'll be monitoring the chat as well.
Okay. If you hear a background noise, I apologize. I work from the house, and my lawn guy showed up just a few minutes ago, so he's back running his little power tools in the backyard here. So hopefully it doesn't bother anybody. Let's go ahead. I'm Fred Erickson. Today we're going to talk about the VMSG dashboard. And the purpose of today is just to provide an overview of what is the VMSG dashboard. There's going to be no test at the end. You don't need to take notes. However, I'm going to warn you in advance that this presentation has been named a drink from a fire hose. So you're going to get a lot of information coming across, but the only idea here is just to understand the big picture of what are the functions of this system, what are we going to use it for, what's it all about. So don't worry about trying to learn everything. We got several other trainings coming up that will get into much more details on the specific functions in here. So first of all, the VMSG dashboard is specifically a public health performance management system developed with public health, specifically for public health, many, many years ago here in Arizona with the State Department of Public Health and Maricopa County, who's I believe the 3rd largest public health jurisdiction in the nation. They were looking for a system to be able to replace all of the spreadsheets all over the wall and all the different tools they had that they couldn't bring all together when they're doing planning. So it is an operational planning and execution system with that PDCA or plan, do, check, and adjust cycle built in. We're going to go into a lot more detail on that. 2011 came along and Maricopa County was using our system already, and they decided to go for FAB accreditation, one of the early ones. And they had a fully demonstrated performance management system. For those of you who are not familiar with FAB, standard 9.1 and measure 9.1.1a require that you have and implement a performance management system, and fully demonstrated is the highest level of compliance that you can get. And just as an FYI, the system is in use by about 240 health departments across the nation. For every one of those folks who've used it for FAB accreditation, and they've done it through the process we're going to talk about, they've gotten fully demonstrated by FAB. So it really does work very well if you're in the accreditation mode. One of the primary reasons is that it has the ability to engage everybody in the organization. And I think that's why we're doing this training for everybody, so everybody understands what particular role that they will have in the system here. In addition to having internal staff involved, you can involve external partners. So
and then where am I? I'm here, right?
Yeah, at least you can hear. I'm sorry. I wish I could have helped you more. But
Oh no, is this right?
as long as you've got noise.
Or did he stop talking?
Yeah.
So what's the background there?
There we go.
Okay, good. Okay.
Talks really quietly.
Well, I'm deaf.
I'm glad we got to see it.
Oh, thank you.
Sorry, you can do more.
That's fine.
Okay. In addition to having internal folks involved, you can have selected external partners involved. So if you think about your community health improvement plan, typically you have bunches and bunches of external partners you're working with. What it allows you to do is communicate directly from the system to those external partners and giving them limited access to come back into the system to help you to keep information up to date in the system here. Pardon me. Let's define performance management, at least related to the VMSG dashboard and particularly public health. There's typically 3 phases in there. Number 1 is operational planning. So you're going to build a bunch of different plans on the system. The ones you see in the bubble up there, what FAB calls their 6-pack of plans, and this is the minimum plans that are required for public health accreditation. Operational plan takes a plan all the way down from a very high level all the way down to specific activities that are going to help you to build the plan. And you're going to have plans for everything in there eventually. You're going to have community health plans, emergency preparedness plans, in addition to what you see up here, the FAB 6-pack of plans. So now once you have the plans in place, obviously you want to execute the plans. As you're executing the plans, you want to be able to monitor them. So we monitor not only at what you call the macro level or kind of the big picture, which allows you to look at, the entire department on one screen or any single plan. So maybe your strategic plan on one screen. But if you think about a strategic plan, you may have literally hundreds of activities in that strategic plan. And any one of those activities at the very bottom level of the plan could start going wrong and mess up the plan at the higher level. And that's why we also have this micro level performance monitoring. So every activity and every objective can be monitored at what we call the micro level. So you can catch things in advance of, kind of messing up the whole system here. The other thing that you see over here is VMSG Public. VMSG Public is just the ability to share any of the information that you have in any plan with the public via a public-facing website. And then the PDCA cycle. As you are executing your plan, you're going to find issues through the plan where you maybe need to adjust the plan or adjust the resources, and that's where the PDCA cycle comes in. What we're going to do is walk through all of these phases in a few minutes here and actually develop a plan, monitor it through its life cycle, and take it through the PDCA cycle. Just to understand the planning model in the system, think of a pyramid. At the very top is your organization. So there's one organization in there, and that's the health department. Under that organization, you're going to have multiple groups. The groups are typically the structure of the health department. So your different divisions, offices, and programs. So you got a community health group, and you got an administrative services group, HR, IT, those sorts of things. In addition, at the group level, you'll typically have what FAB calls those 6-pack of plans, or your highest level plans in there. So your strategic plan would be a group within itself. Underneath the groups, then, every group has a specific set of services or initiatives. This is what do we do for the organization, or what do we do for the community? And services are ongoing things like WIC, is a service that goes on and on, has been going on for years. Initiatives are things you're attempting to do in the future. We're going to talk about an example today of tobacco cessation plan that we're going to assume that you're just starting out as an initiative. Then every initiative has a set of goals, every goal a set of objectives, and every objective a set of activities. So I think you can see how the pyramid gets pretty wide at the bottom. And literally a plan like your strategic plan could have hundreds of activities down there at the bottom. So we have a little demo organization we call USA Public Health. And now I'm going to take you live into the system. A lot of you have probably already logged into the dashboard. And if not, you're going to see a screen very similar to this. Up at the top, if you look at these tabs, you'll notice that it's that pyramid I just showed you flipped on its left side. So the organization.
Thank you. Oh, you do. Thank you.
Service initiatives, goals, objectives, and activities. So I'm going to go to my groups tab now. I'm going to go down to our little group called Tobacco 2023, which reports up community health in this case. I'm going to go ahead and mute everybody. I've got some feedback in here. Would everybody please check your mute and just make sure that your microphone is muted? We're getting a little feedback in here. Maybe Yvette. Okay, let's go ahead. So what we're going to do now is we're going to build a little plan in our group called Tobacco 2023. Under that group, we're going to have a set of specific services or initiatives. And in this case, we have 3 of them. We have tobacco cessation, which we're going to work on today, secondhand smoke, and tobacco initiation prevention. Under tobacco cessation, then, we're going to have a specific set of goals. And these goals are related directly to tobacco cessation. So reduce smoking in high school is a goal. Reduce smoking in colleges. Reduce smoking in public areas. So the goals are typically pretty high level. They're not real specific at this point in time, but it gives you an idea of what we're trying to accomplish. Over here on the left-hand side, you'll see the traffic lights over here. Green traffic light indicates things are moving along as expected. The yellow traffic light would indicate things are something is going wrong, and typically we identify that down here in the notes field. So in this case, it says one of the high schools is not at the planned reduction. Okay, gives us an idea why we have a yellow light up there. A red light would be, we had to bring the whole program to a halt due to something like COVID or whatever. Then the gold bar that you'll see indicates successful completion of a portion of the plan. Not everything is ever getting to a gold bar. Like reduce smoking in high schools, you probably never get to 0, so you're never going to be completed. But if this goal said create a strategic plan, at some point in time you're going to be done. You mark it as gold, indicating that that portion of the plan is completed in there. Again, if you change the traffic light up here, put a note down here in the bottom right to let people know why you did that, so that they don't have to call you and say, "Hey, Fred, why did you change that traffic light to a yellow?" There's a note down here in doing that. The other thing we have the availability of is to connect a data source to any planning element here. So in this case, reduce smoking in high schools, I've got a data source called CDC Smoking Cessation Fast Facts, and I can create that data source very easily. I put a text description that shows up down here and a data link in here. So in this case, I've got https://cdc.gov, and then goes all the way down here to the Smoking Cessation Fast Facts. When you put a link in here, the link has to start out with either http:// or https://. So you have the entire link in there. Click OK. When you do that, it creates this little link button down here. And if I click on that, what it does is open that website in a new browser window here. So I've got the information from here that I might be using to update my plan. So now what we have is this general goal of reduce smoking in high schools. The next thing we're going to do is drill down to our objectives. The objectives are what we call SMART. So SMART being specific, measurable, attainable, realistic, and time-based. So as an example, reduce smoking at Wayne High School by 25% by the end of the school year. So we put a finite target out there of exactly what we're doing. In order to get us there, we're going to assign this person called an objective lead. And I can sit here and say, show everybody in our little department here. In this case, we've chosen Steve Hansen to be our objective lead. And Steve's job is to get us to this target within the time frame that we've selected here. So we're going to leave Steve as our objective lead. Now, some plans tend to stop at this level. They tend to stop at the objective level.
Excuse me, Fred. Excuse me. I just want to send a message to Yvette. Yvette, can you mute yourself? Can you mute your microphone? We're having a lot of noise, background noise.
Yeah, it's not even letting me mute her from here.
Yeah. Yes. Thank you. Thank you.
Thank you. Okay. The objective is the target. This is what we're trying to accomplish. And again, some plans, like strategic plans, tend to stop at this level. We've identified the target. We know what we're going to do. We're going to go out and do it, which works really well until somebody comes up to you and says, hey, how are we going to do this? At this point in time, what we're going to say is we're going to have a set of action steps, or what we call activities, which are the steps we're going to go through that we believe will get us to that target. Now, in the VMSG dashboard, there are 3 different types of activities. Project-based activity is the most common. Quantitative measurement would be the second most common, and then QA or quality assurance activities are the third most common. I have an example of each of them up here. We're going to walk through so you can see the difference and when you might use them in here. So our first activity is create training content materials for students and faculty on the dangers of smoking. So what we're going to do is build PowerPoints and videos and that sort of thing so we can go into the schools and we can actually do the training in front of the students and faculty. Every activity's got a performance metric. The performance metric just says, how do I know when I've successfully completed the activity? So if we're trying to create training content, once we've created the training content, hey, we're done with the activity. Every activity has got a date range in here. So we've got a beginning date and an ending date. So this is when we're going to do it. And if things change along the way, you can change these dates to make it a real plan. Then you've got a measurement over here. In this case, it's 0 to 100%. So you notice down here in the notes field, so Diane is our activity lead. So Diane probably was entering this information in here. And she said, after chapter 1, this is probably at 25%, chapter 2, 50, chapter 3, 75, and then 100% after chapter 4. When you go to 100% on a project-based activity, it automatically sets the traffic light to gold for you, indicating that you've successfully completed this in here. Over here on the left-hand side, you'll see that we have the ability to assign teams. So I'm going to click on the little pencil icon here. Now clicking the little black X opens it up to the whole department for me. So here you can see 3 columns: team member, team lead, email notification. The team member is exactly that, the folks who are actually working on creating this content. The team lead is the person who's kind of leading the charge here. In this case, Diane Cox is leading the charge. Email notification is part of what we call real-time planning. Real-time planning allows you to update all the elements of the plan directly from the source, if you will. In this case, from Diane. Diane's going to get an email from the system. It's going to link her back into the system to write to her activities, and she's going to update that, hey, we're 50% done with this training content. And we're going to talk a lot more about real-time planning in a few minutes here. On the right-hand column over here, FTE, or full-time equivalent, what you're looking at is how much of this person's time is going to be dedicated to this particular activity during the time frame of the activity. So you can see that Diane is about a 0.1 or about 10% of her time, and William is about 10% of his time, and Andrea is about 30% of her time doing this particular activity in here. And what we do with that is several things. One of those is we roll it up the pyramid. So at the activity level, you can see we have the 0.3, 0.1, 0.1 is a 0.5 FTE in order to accomplish this activity. And if I go back up and look at all three of these activities rolled up to their objective, I can look up here and I can see that we're at a 0.7 FTE to accomplish this objective. So what that allows you to do is kind of understand the cost of doing this kind of a program. And typically that function is only used during budgeting cycles in here. So it's kind of an option. Back to our activities. The other thing we have is the ability to assign external partners. So there's an external partner database that you put your partners in there and your partner contacts. So in this case, we're saying that our external partner organization is VMSG Dashboard, and our external partner contact is Fred Erickson at VMSG Dashboard. So what I've done is tagged Fred to be a part of this particular activity. If I choose to, I can make Fred a system user, which allows him to be the person receiving the email notification. So instead of you having to contact Fred and say, hey, how are we doing on this content creation, and then going back and finding the activity and updating it, it'll go automatic to him. He'll go right back and update that activity, and you saved a lot of time and effort in there. So that's our first activity, is create training content. Our second activity then is going to take that training content and provide 9 training sessions each month on the dangers of smoking to students and faculty. This is what we call a QA, or quality assurance activity. Now, every activity's got this little wizard guy over here, so I'll click on that, and it kind of defines the parameters of that activity. So you'll notice we have a start date but no end date, and the reason for that is because we have a frequency. We're saying this is a repetitive activity. You're going to do 9 training sessions each month. So during your measurement time, which is during the month here, you want to be able to say, I did 9 during this month. So what it does is just keep moving the date ahead for you, so you're always within the right time cycle here. So in this case, we're saying monthly. It can go anywhere from weekly to every 5 years. In addition, we have the ability to set the traffic light automatically based on the values we establish. So in here, we're saying 9 is our target, right? So it's to say, hey, if we get to 9 every month, we're going to be green. If we are at 6 or below, this is just a random number that we chose in here. We're going to say at 6 or below, we're going to be red. And if we do 7 or 8, it's going to be yellow. So you'll be able to tell by the traffic light exactly where you are in the status of this one. We have a metric type that says training sessions provided. When you add all this up, it builds the performance metric for you. So you can see training sessions provided, measured monthly, green, yellow, and red. So this is the QA activity. Again, it's repetitive, and it automatically sets the traffic light for you. Our third activity then is going in parallel with doing the training. We're going to go contact all the tobacco vendors within a mile of Wayne High School, 20 of them, to make sure they're not selling to minors in here. And again, through our little wizard, we can say we have a beginning and ending date. So this is when we're going to do it. We're going to put a target number. In this case, 20 tobacco vendors is our target. We're going to say we're going to count. So decimal is just, counting. Or we can do dollars in here. So if I wanted to be able to do budget work or manage grants or something like that, and I wanted to manage the dollars in there, I can use dollars in this particular activity. Our metric type, tobacco vendors contacted. And then a data entry type. The default is enter a value to add to total. And what that just says is, as I'm going through the process, I can put a value in here. Let's say every month, I can say I did 5 this month, and it'll make this 25 and calculate the percent to be 125%. And then the next month, I can go and say that I did 3, and it'll add it, and just keeps track of it for you. If I were going to do this whole activity in, let's say, 1 week, and I'm just going to go at the end of the week and say I did 20, I could say enter a new total value. It just gives me this field to enter it. Doesn't do any calculation for you other than your percent complete here. So that's the quantitative measurement activity. The project-based activity and the QM activity are very, very similar. other than the project-based activity, you're calculating a percentage, or you're coming up with the percentage, and the quantitative measurement activity is calculating the percentage for you. Now, if we take our plan we just created and go back to our pyramid, it looks like this. The group we were working in was Tobacco 2023. So that's the big picture. That's the group. The initiative that we selected of the three was tobacco cessation. The goal under tobacco cessation was reduce smoking in high schools. That SMART objective was reduce smoking at Wayne High School by 25% by the end of the school year. And then the steps that we believe are going to get us to that objective are create the training curriculum, provide 9 trainings a month, and contact local tobacco vendors. So this is the planning model that's integrated in the system. Every plan that you build will be in the same planning model. And the benefit of that is it's easy to, once you learn it, easy to build your plans in there. And it's easy to compare plans, look across plans, because it's always in the same model. Now, we're going to take that plan we just built. We're going to walk it through the PDCA cycle. So P is what we just accomplished. We have a plan in place. Now let's execute the plan. To execute the plan, we have to, number one, create the training content. Then we have to take that training content and go out and do 9 training sessions each month. And then in parallel with that, we're going to go out and start contacting tobacco vendors. And that's where the real-time planning comes in. In order to be able to judge where you are in the success of the plan, you got to have information. You got to be able to collect and say, hey, how far along are we in creating the training content? How many training sessions did we do this month? How many tobacco vendors did we contact this month? If you don't have that information, you've got to go collect it before you can do what we call the check phase. If you let the system do it for you, it's going to email each of those activity leads and objective leads, and it's going to ask them to go back in and update just that information we just talked about, so that when I go into my check phase, I'm working with real-time information. In the check phase, what we're going to do is actually go in and see, hey, how are we doing in here? My computer wants to be slow today for some reason. So I'm going to go back to my objective. So reduce smoking in Wayne High School by 25% by the end of the school year. Down here, the percent reduction that we're at is 25%. So we've got a plan of 25, got an actual 25, everything's working great. If I want to look at how we did over the lifetime of the plan, I can look at this, and it says, okay, we ramped up, got to our 15, 18, 20% reduction, got to 25, and we're capped off at 25 and holding there. So what's going on is we have a plan of 25, an actual 25, everything's working great. Back to PDCA. At this point in time, then we're going to go and make any adjustments if necessary. Well, what we just saw is we have a plan that's working beautifully, so I don't need to adjust the plan. I'm going to continue to execute the plan. At some point in time, I'm going to go in and check it, maybe once a month, once a quarter, and continue through this cycle. If I need to make adjustments, I'll do that. So this is the kind of the number one. It says that I don't really need to make any adjustments based on the information that I've collected from the real-time planning. Now, if I go look at the other objective here, first thing we'll notice it's got a yellow light. I'm going to go down to the notes field. It says not quite to the 25% target due to COVID restrictions on training and vendor visits. Okay, making sense. Down here, my percent reduction says I'm at 21% and not 25, hence the yellow light. If I go to my chart again, I can look at that. It says, okay, we ramped up, capped off at 21%. So at this point in time, what we know is we're not making the plan. What we don't know at this point in time is why. So we're going to go back here and kind of dig down into the activities and figure out what's going on. So our first activity, create the training content. The gold bar says, I'm done. Don't need to do anything. Number 2, though, however, has got a red light out there. Provide 9 training sessions each month. Down here it says training slowed due to COVID. Okay, let's look at our chart. So we ramped up to our 9 training sessions a month for about 3 months in a row, and then boom, fell way down here. At this point in time, let's assume this was the time when COVID came around and kids had to start staying home, not being able to go to school. Well, our training was going into the schools and doing the training, so we're not able to get to the kids and continue our training. Then the other thing we had going on here was able to contact all 20 tobacco vendors. We got a yellow light out here. It says difficulty contacting vendor due to COVID restrictions. Okay, again, looking at our chart, this is the number of vendors we contacted, got up here, got to 15, never got to that last 5 vendors. So they could be doing something bad out there. So between the idea of not being able to do the training and not being able to contact the tobacco vendors, we're probably in trouble here, not going to be able to meet our 25% reduction target here. Now, if I go back to the PDCA cycle, at this point in time, we are going to want to make adjustments. The other adjustments that you could possibly make, other than the first one we saw where you don't really need to make an adjustment, is we could potentially adjust the plan. So let's take the scenario that we're coming into COVID time. We realize it's going to eat up most of the resources in the department. We probably won't be able to add any additional resources to get to that 25%. But maybe if we're kind of happy with the 21% for now, we'll adjust the plan to 21 so we have success, go through this plan until COVID's over with and we can get back into it. So that's one option, is adjust the plan. Another option might be to adjust the resources if possible. So let's say we know that we have a training curriculum that is only developed for face-to-face. We don't have anybody to go to face-to-face because the schools are closed. So let's take that training curriculum, if we have the resources, and adjust it so we have like a Zoom-based training or something that we can get to the kids now when they're at home and do the same level of training through the Zoom-based training. Then the other resource was contacting tobacco vendors. Obviously, we wouldn't have anybody to do that. They're off doing other things related to COVID. So maybe we have some grant funds. We can hire an external contractor to go contact those last 5 tobacco vendors just to make sure they're not doing anything bad out there. And then the fourth option would be maybe a slight adjustment to the plan and the resources. So maybe the only resource we could do is convert the training to Zoom-based because maybe it's pretty easy to do. And then maybe we think that'll get us to a 23% target. So adjust the plan and the resources and continue through the cycle. So all your plans are going through this cycle, and it's critical to have some kind of information in here. There's 2 ways to get it. Either you let the system collect it for you through the email notifications, and we'll go through that process here in a few minutes. Or every time you want to check it, you got to go out and manually collect that information. So imagine you got 3 people out here doing different things. You got to go get hold of them, either email or phone or text message or whatever. How you doing on creating the training content? Okay, you go put that in the system. You got to find the activity and put it in there. How many training sessions did you do last month? A little bit of phone tag, you get back and you put it in there. How many tobacco vendors did you contact? Same thing. The system will do that automatically for you, so you don't have to worry about that. You just go into your check phase. You look to see, hey, I've got real-time information. I'm good to go. We talked about macro level performance monitoring. At any level in your organization, you can develop a dynamic dashboard like this. I'll show you what it looks like. So from my group screen, I can select any group in here. So I might be selecting the department itself. If I want to do that, I can look at the entire department on one screen. I don't know why things are slow here. So I can look at a dashboard for the entire department. What is the current performance of the entire department? I can look at just my strategic plan. So I want to see how are we performing on our strategic plan. I can look at any division, office, or program. So I can look at HR, I can look at IT. In this case, I'm going to be, let's say I'm the community health director. Under community health, you can see I have tobacco and WIC. Maybe I come in the morning and I just want to know, hey, how is my division performing today? So all I got to do is go up to this little traffic light in the top right corner, click on that. Take a few seconds to gather up all the data points to show me that dashboard. But it's going to, it's going to show me a very succinct dashboard of the performance of community health and the subgroups under community health. So the top left corner we call the big picture here. And what we're just looking at is the number of traffic lights in each status. Now you'll notice that everything is clickable, so I can drill right down to that particular traffic light that's red and figure out why it's red and maybe make some corrections to it and get it back. I also have this schedule gauge. The schedule gauge is just showing me for all of community health activities, we have a beginning date, ending date, and % complete. For all of those activities, how are we doing against our timeline? And say we're 11 days ahead of schedule. Get down below schedule, it turns yellow. 60 days below schedule, it turns red. So just by looking at the colors, you get a good snapshot. I can also go up the pyramid if I want to. I can go to the objective level and the goal level and get the same snapshot. Down at the bottom, I have the ability to look a little deeper. So first thing I can do is look at, these are all my community health people. So I can look at those folks and I can determine, first of all, last time they updated their information. Green means less than 30 days, yellow is 30 to 60, and red is over 60 days. In an ideal world, you want everybody to be within that 30-day window here so that you know you're working with real-time information as you're doing your check phase, if you will. When you get to yellow, there's a possibility that maybe this person was on vacation the week that the email came out, so when they get back, they're going to fix it up. So that'd be okay. When you get 60 days out, you might want to go to William and say, hey, let's provide you a little training on how to do these quick updates on the system to make sure that you can kind of keep up with everybody. Here's another use of that FTE number. You can roll it up by person. So in this case, you got people that are way, way overloaded. 2.05 is, double. You're doing the work of two people in here. You got William, who's at a 1.0, which is kind of ideal. Down here, you got Tom, who's at a 0.5, which is probably a little bit too low. So you want to maybe take some of the activities from Diane or from Andrea and assign them to Tom. And again, I can click on anything on here to get to those activities. I can reassign them right there. When I go back to the dashboard, it'll show up in real time. This column is showing me lagging, which says I have activities that are calculated to be behind schedule and then color coded again as to how far behind schedule. The days column you see is the same as the schedule gauge up here for the individual person. So for all of the activities that you've been assigned, you are, in this case, 77 days ahead of schedule. So they're doing really well. Overdue indicates that I have activities that are past the ending date of the activity and not yet 100% complete. And then the number of red, yellow, green, and gold. So first thing I can do is look at my people. I can also replace that first column that says activity leader with my groups screen. So in this case, it would be community health, WIC, and tobacco would show up down here, and the same basic information over here on the performance. And the third one is strategic priorities. What that is the strategic priorities from your strategic plan mapped down the left column here. And then again, the same data over here. What you're doing is making sure that everything you're doing in the department is represented in your strategic plan. Top right corner, my priorities. These are individual objectives that you personally want to keep your eye on. On the objective screen, there's a little green flag that you can set, and they appear on your login only. Everybody can select the same one, so you can all see the same thing, or people can select different ones. Typically, you're going to select the things that are important to you or your team. And typically, they're going to be reds and yellows, because if they're green and gold, you kind of know that they're already on track here. So again, I can drill down on that objective. I can unselect it, take it off there, or maybe make corrections to it to get the lights changed or whatever I need to do here. So that's the dashboard. Again, it's any piece of the organization. So you remember back in the objective, I had Steve Hansen as the objective lead. I could go into Community Health Division as Steve Hansen, or maybe my tobacco program that I'm in charge of, and look at just that tobacco program on a dashboard screen. So at that point in time, I get a good status of how am I doing. Now, during COVID time, we had a lot of extra time, so we took and built some additional functionality, and one of those we call VMSG Mobile. What that is the ability to have that exact screen you just saw broken down into 3 phone screens. So you got the top left corner, the bottom, the top right corner. Functionality is identical. You can click on anything in here, drill down, whatever you want to be able to do. And one of the nice things is, I'm not sure how you guys do in your department. A lot of departments have like company phones, if you will, and they're locked down by IT as to what you can put on there. You don't need to have an app on here. This is actually a dynamic app that's built in your web browser from our servers. So you just log in just like you would anything else into your web browser on your phone, and it'll take you and build the app in the phone, so it's always in real time. What we just talked about is what we consider to be the core functionality of performance management and obviously the VMSG dashboard. So if you take that Fab 6 packet plans that we have, get those in there, you're working in the accreditation plan, which I'll show you a little bit later here, got real-time planning enabled, and you use this for accreditation, you're going to probably, in fact, 100% of all of our accounts have gotten fully demonstrated for 9.1.1 by doing that. So it's a very effective system. Over the years that we've had it out there, we've had a lot of great feedback from people on other things that they'd like to be able to do. Like VMSG Mobile is one of those things. So what we're going to do now is we're actually going to go in and talk about the additional functions, and we're going to kind of go quickly through those to get you guys out of here. But before we do that, any questions I can answer on what we've gone over so far? Okay, let's continue. Intelligent document management. Up until about 3 weeks ago, this was just document management. Built into the system was the ability to attach documents to anything that you were working on in the system, any person, any group, any service initiative, goal, anything in the system, you can attach unlimited number of documents to. The reason that was built in there was originally for FAB accreditation. When you go through the accreditation or reaccreditation process, there's in the neighborhood of 300 to 1,000 documents that you have to submit up into what they call the EFAB system. What you can do is attach all the documents to your plans in here so you know exactly where they are, and you keep track of them, keep the latest versions, all that kind of stuff. And then you can download them out of here and put them up into the EFAB system. What we did recently is we added the ability to kind of make it intelligent. And here's what we did. We added a new kind of activity. You may have seen it. There was a timeline checkbox in the quality assurance activity. And what that does is, here's the example. Every department has got either bunches and bunches of standard operating procedure documents, memos of understanding, policies, all kinds of stuff. Every one of those typically has a timeline on it that says it has to be updated every quarter, every year, every month, whatever it happens to be. And it's very difficult to track that because every activity or every document has got a different person assigned to it typically who has to do the updates. So here's what we did. We built the ability to have a plan in here. So in this case, we would have under our administrative services group, we have a service called SOPs or standard operating procedures. One of our goals might say to manage and update all administrative SOPs. We have another goal down here that says manage and update all emergency operations SOPs. And you could have, as many of those as you need in there. Under the goal, you're going to have an objective that says manage and update the destruction of records SOP, that document. You're going to attach that document right there. Now, under that objective, you're going to have an activity. The activity is to update the destruction of record SOP annually. So what we're saying is every year this has to be updated. This is a document link back to this document, so you're always working with the same version, the same copy of the document. Now, what you can do at this activity level is we call it timeline activity. You set it as a QA activity, you set the timeline, it gives you a field to put in the yellow light, basically. So what's going to happen, and I use the example of 80%. So an annual cycle, 80% of that would be about 9.5 months. 9.5 months into the annual cycle, the light's going to turn yellow. The person who's designated as that activity lead is going to get an email from the system to please go in and update your activity. That activity being updating the destruction of records SOP. So you can use this to manage any kind of documents that have a specific life cycle associated with them where they have to be updated. And you can assign it to the people who are responsible for doing the updates in there. So that's the intelligent document management. Lots of reports in the system. We are actually going to, one of the future trainings here is to actually go through the reporting and all the graphs and charts that you've seen today. But the most common type of report is this top one up here we call an operational plan report. For the example we're working on today, it would look like this. The group, the initiative, you see this green says there's a document attached to the initiative. There's that data source we talked about, the CDC smoking cessation fast facts attached to the goal. I've got the notes down here in blue. I've got all my traffic lights, all the people that are assigned. I've got a bunch of information in here. Probably this level of detail would only be really interesting to Steve Hansen, who's the objective lead. Everybody else just kind of wants to know, hey, how are we doing? And that's where VMSG Public came from. VMSG Public is the ability to create public-facing web pages specifically around any data elements in the system. So in this case, I have our tobacco program, our goal, reduce smoking in high schools. And I've got the number of traffic lights in each status over here. So it's very similar to that dashboard, except it's obviously a pie chart. So the number of gold, green, yellow, and red, and our timeline gauge says we're 11 days behind schedule. Down here, I've got the objective underneath the goal. Same thing, I can do the rollover and see how many gold and green we have, and we're 9 days ahead of schedule. Down at the activity level, create the training content. I can roll over and say that we're 25, 50, 100% done with the training content. I can build, these are called indicator rows. I can build as many of those as I want and as many web pages as I want. When you build the web page, it just gives you a unique web address. I copy this, I put it into an email, maybe to send it out to the board to say, here's how we're doing on the tobacco program, or here's how we're doing on our strategic plan for the year, whatever it happens to be in there. The other thing you can do is take this to your IT folks and say, hey, please build me a link on our public-facing web page so the public can go in and see how we're doing on any piece of any plan in the system. And again, these things can be as long as you want. They can scroll forever. Before we go to we got two more short sections to go through, but any questions before I do that? Okay, let's go. Three-dimensional planning. Kind of I guess more or less a future thing. As you guys get all these plans implemented in the system, it's nice sometimes to look across all the different stuff that you have in the system for commonalities. Where do we have gaps between plans where we're not doing things? Where do we have overlaps? And that's what three-dimensional planning is all about. It allows you to go in and say, hey, what things are we doing across the whole department that are related to public health essential number one? In the fab world, you want to go in and say, what are we doing across the whole department related to Fab Standard 6.1? So as you're doing your site review with Fab, this is a great tool to be able to go and show the site reviewer, here's everything we're doing across the whole department related to 6.1. Those strategic priorities from your strategic plan get mapped against everything else in the system here, so I can get that bottom of the dashboard screen. All those documents that you may have in there, you can categorize them against any number of standards. One of those might be the Fab standard. So I can go and say, these are the 3 documents we're going to submit for standard 4.2. So that's 3-dimensional planning. It's a big umbrella over everything else in the system. Accreditation and reaccreditation project plans are all built in. I'll just quickly take you through one of them. So they're under the groups tab here, and there's bunches and bunches of them. The one where let's go look at Fab Reaccreditation 2022 local. So that's where you guys would fit. So if I go in down through here and I start dropping down through the pyramid, you're going to see the domains. And in the version 2022, they reduced it from 12 to 10 domains. The number that you see, the goals are the standards are the goals. Under the standards, then you're going to have the measures. There's about 85 measures in version 2022, but this is where the documents go. It says the document that you're required for this one is 1 community health assessment dated within 5 years. So that's really nice, unless you don't know what's supposed to be in a community health assessment, and that's what's in the activities. There are 7 things that FAB requires to be in your community health assessment. One of those is include in the CHA a list of participating partners involved in the process. Okay, here's my document management button, which you see on all the screens. Click on that. It says I have partner list version 3. I'm going to go say, show me all the versions. So I have version 1, version 2, and version 3. My latest one is obviously version 3. The traffic lights that you see are very common to use in document management. So a draft usually is a yellow light, meaning it's not complete. The green would be finalized from the department's perspective. And then the gold would be if I'm submitting it like into EFAB, I've submitted it into EFAB. What that allows you to do is then just scan through all the documents. There's a whole document screen on the main menu that you can look at all the documents in the system. You can just scan down there and say, whoops, here's a green one that we didn't submit up into the EFAB system. Just allows you to look at them easily. You also have a lot of information that you can put into the document management. So in addition to the file name, which you'd have on a drive or SharePoint or anything, you've got things like the expiration date of the file. So every document within FAB has got an expiration date of somewhere between now and 5 years from now. So you can put that in there. You can put descriptions and notes and traffic lights and all that kind of stuff. And again, in future trainings, we're going to go in a lot deeper into all this stuff. So that is the accreditation and reaccreditation plan that's built into the system. Now, a lot of health departments during COVID were still pursuing accreditation, but they had a problem. If they wanted to have what they call a mock site visit, meaning they're going to hire some FAB expert to come in and review all their documents and review all their plans before they submit for their final FAB site visit, just to make sure that they have everything ready to go. The people couldn't come into the departments. People were working from home and whatever. What we did is built the ability to have a virtual mock site visit in there. So what you can do is the people can actually walk through your plans, walk through your documents, and they can grade them. And they'll grade every activity in that plan. When they're done, there's a report called accreditation review report. That report shows all of your stuff, plus all of the grading that's done in there, and lets you review it top to bottom so that you know that either you're ready or you got to make a few adaptations before you're ready. And they can do it remotely. If you find the person that you're going to do this with, we'll train that person on how to do it. It's a very simple process. They'll come into your system remotely, get it all done. And it's a very, very effective process for virtual mock site visit. Built into the system is training, help, and information. So I'm back here at my activity level. I'm going to go up to the blue eye in the top right if I have any questions on what to do on this screen. It's going to take me to adding and managing activities down here. And then over on this side, it's got the steps to go through for adding an activity, all the different types of activities. If I'm going to remove an activity, if I'm going to edit an activity, just all the bullet steps, very simple, short, and concise. In addition, here's a video training module on activities down here, about 5 minutes long typically. Here's the entire user guide in a hyperlink PDF file. Here's a document we call implementation guidelines, which is just stuff we've collected from clients over the years on, what works really well, what doesn't work so well. Here's some IT issues we ran into. Here's a couple of templates that we created to be able to develop operational plans, things along that line. So just a good read as you're implementing the system. Up here at the top left corner, the top 5 bullets are training videos. Today, we're going through the introduction. If you guys like doing, if you're the kind of people who like doing online training, here's 3 different modules that you might want to go through. The basics, operational plan development, which is the next one we'll be doing after this, and then performance monitoring training. If you want to do it that way, you can do it that way. We'll be doing it live as well, so it's up to you. The admin level is for people like Claudia, who are the administrators, to be able to go in and manage all the permissions and that sort of thing. But this is all built into the system. It's available 24/7. Okay, we've got one more section to go through, but any questions before I do that? Okay. Intelligent real-time planning. This is that ability to collect all the information in the background. Think of accreditation again. You got 6 plans in there. Each plan, let's say, may have 100 activities when you get down to the bottom of the pyramid. So across all those plans, you may have 600 activities. In order to be able to manage those plans, you got to keep that information up to date. So your choices are either manually go out and collect it when you need it, which is I do not recommend with that many activities. You're going to be spending all your time doing that, or let the system do it in the background. So here's how it's built in. Real-time planning is typically set up on a monthly basis. So you're just going to get an email from the system once a month. You can set it up anywhere from daily to monthly, but I recommend monthly, and most people use it for monthly. What you're going to be doing at this point in time is you're going to set it for a monthly cycle. Let's say we set it for the first Monday of the month. On the first Monday of the month at 1 o'clock in the morning, the system goes in and looks at everybody that you assigned as an objective lead and an activity lead, and it asks 3 questions. Number 1, have you been in the last 30 days and updated your stuff? Number 2, do you have anything that's falling behind schedule? Number 3, do you have anything that's actually overdue, meaning past the ending date? If any of those is true, out go the emails. As I mentioned earlier, they can go to internal folks as well as external partners. There's a link in that email that takes you right back in to log into the dashboard. You're going to go in, we're going to actually go live into this so you can see the process here. You're going to go into the quick update screens, very simple screens, only 3 fields on each screen to update, and then you're going to log out. Just to give you a number, across all the health departments, the average for this cycle is about 3 to 5 minutes per person per month. So it's a very, very efficient way to collect the information. And I recommend that those activity leads are the people who are actually doing the activities. If you call them feet on the street, the people are actually doing it because they're going to have the easiest time updating how many training sessions did I do last month? Well, I know that answer. How far along am I in creating the training content? I know that answer. How many tobacco vendors have I contacted this month? I know that answer. So getting that in there just makes it very simple and effective so you have that real-time information. So that's the real-time planning process. Now, the screens that you'll see, the activities quick update screen, the top of it is merely context. So it's the top of the pyramid. Group, service, goal, objective. Activity 1 of 6 I'm going to be updating today. The activity and the performance metric. And again, 3 fields. You change the traffic light. I can update that data value. I can put in a note, hit the next button, cycle through all these activities, and I log out. I'm going to walk you through this process live here in a second. The email that you get will look similar to this. It says, here's why I got it, those 3 criteria I mentioned. Just FYI, all of the activities you've been assigned have this traffic light status. This is a contact for your administrators. So Claudia will be in here, and whoever else you have assigned as org admins will be in here with their contact information. And then the link. This link takes you right back into the dashboard. It's going to take you into the login screen. First thing I'm going to do is walk you through kind of a step-by-step process. I'm just going to define the process. Then I'm going to actually go through the process for you. So logging into the dashboard. First thing you're going to do is go to this link, login.vmsgdashboard.com. That's one option. The other option is just go to vmsgdashboard.com. There's a link in the top right corner. It says log me in, and you can go in there and do that. On the login dialog box, there's a button on there called send. That means send me my information. I'll hit the send button and enter my email address and click send again. You're going to receive a dialog. It's either going to say success or it's going to give you some reason I couldn't find your information. If it says success, hey, that means found your login, found your email address, sent you an email. If you don't get that success box, please contact us and we'll get it taken care of for you. Now you're going to go back. There's a login button on the middle of the screen, which again, I'll show you here in a minute. That login button is going to take you to the actual login dialog again. You're going to enter that user ID or your email address. Either one works as your user ID. If you don't want to remember a new user ID, hey, go ahead and use your email. Enter your password, click login, and you're into the system here. So let's actually go through that process here. Top right corner of this red button is my logout. So I'm going to click on that, log off here. This is what I was talking about before I go to the dashboard, vmsgdashboard.com, net or org, any of them work. Up here is the link, already a user login here. So I'm going to click on that. It's going to take me back to my login screen. So the first thing I'm doing, here's that send button I was talking about. I'm going to click on that. I'm going to put in my email address. If I could spell it would be better. And I'm going to hit send again. Here's the dialog I was mentioning. Success. Hey, I found your user ID and password. It's been emailed to you. You're good. Now, I'll go back here. Oops. Sorry. The email that you get is going to look something like this. It's going to have your user ID. Again, you can use that or your email address. And if it's the first time you logged in, it's going to be a crazy cryptic bunch of strings in here, a string of characters in here. So I'm going to walk you through the process to change your password as well. But you'll get an email like this. You probably want to copy and paste at least the password into the login. We'll go back over to here. There's the login button I was talking about. I'm going to click on that, open up that dialog again. I'm going to go ahead and put in either my email or my username, my password. I'm going to hit login. Now, if you have been designated as an activity or an objective lead, you're going to get this dialog. It says you can either go to the main menu or you can go to the quick update screen. Most of you will be using the quick update screen most of the time you log in here. So I'm going to go ahead and click on that. It's going to take me to my activity quick update screen, the one I just showed you here. And it's going to look like this. Up here I have my group service goal objective. It says activity 1 of 17, gives me the activity, the performance metric, and then the 3 fields to update down here. For now, let's go ahead and change that silly password that we got. So I click on the keys up here. Probably want to copy and paste out of the email the current password, put in whatever new password you want, verify new password, hit update like every other website in the world, and you're all set. Now, I'm going to go through my activities. A lot of them, by the way, you'll find that they just haven't been updated. There's nothing to update in them. Same status. So you can just use this button on the bottom right to cycle through, or up at the top right, the next activity button, the same one. They do the same thing. So I'm going to go ahead and cycle through all those activities here. So I'm on activity 17 of 17. So I'm on my last activity. If I click the button again, it's going to say, hey, you've been assigned as an objective lead as well. Do you want to go do those? Let's say yes. We'll hit the objectives button. It's going to be a very similar screen, except my objective is up here. Remember, it's above the activities. I'll go ahead and go to the next one. So my objective, any notes in here, my data field, my traffic light, I can cycle through all 4 lights, put in a note, hit the next button, go on through all the activities. Now, as the objective lead, you're also kind of in charge of the activities for that objective. Down here, you'll see the ones in blue. That indicates that they are assigned to you, which means you just went through them in the activities update. So you're done with those. The gray ones are assigned to somebody else. So you, as the objective lead, probably assign these to one of your team members. So you assign them to somebody else. However, you still have the ability to go in and update those activities from here. So you can click on any 4 of these, do the update. But like I say, you've already done the updates on the bottom 2 in here. And then when you're done with the objectives, you're going to click the log out button and you're set to go. In addition to doing what we just saw on your desktop, you can again do that on your phone as well. So if you get the email, let's say you're driving into work, you stop at Starbucks to have a coffee, you're sitting down there, you pop open your phone, and there's an email from the VMSG dashboard. There's a link in there. You touch it on your finger. It's going to take you into the login screen, same exact login as you had on your desktop. For the mobile, you're going to go to quick update. It's going to give you that same dialog box. You go to quick update, and you're going to get the activity quick update screen, just a simpler screen, doesn't have all the context. When you're done with the activities, you're going to go to your objectives. 5 minutes later, you're done for the month. So it's just a nice kind of a convenient way to do it. And that, as promised, was your drink out of a fire hose for the day. Any questions? Anything else you'd like to see? Okay. Well, I'm going to let you
And
go ahead, Claudia.
yeah, I just wanted to make you all know that if you happen to have later on any questions, any additional questions that were not covered or not completely fully understood today, you're always welcome to further them to me at any time.
Thank you. And also, the next level of training that we're going to go through, since everybody's kind of been given the drink from a fire hose, the next level is what we call operational plan development. So for any of you who are actually going to be entering or developing operational plans in the system, you'll go through that training. It's just how exactly to do it, the step-by-step procedure to do that. Then we go through and ask you to actually create and enter a plan in the system during that training or after that training. Then we'll go back and do a review of the plan that you entered, just to make sure that everything is understood up and down the pyramid there. Once we're done with those trainings, we go into what we call performance monitoring training, which is all the graphs and charts and VMSG public, all the reporting, all that kind of stuff. So that'll be the next things to look forward to, again, if you're going to be in the mode of actually entering and developing plans. So if there's no questions, I want to thank you all for your attendance today. Have a wonderful weekend, and I'll see you all later.
I actually had a quick question.
Oh, go ahead.
Are these going to be similar to the videos that are been provided to us, the ones that are on YouTube?
Yes, they are. Now, just FYI, the same videos are on YouTube. However, we had an issue with YouTube because they said we had some bad content or something in one of the videos. So if you go into the dashboard and go to that eye in the top right, you can go to those same videos, but they're actually on our server, and we don't limit you like YouTube does.
Cool.
But yeah, they are the same videos if you can get to them. Okay.
Cool. Thank you.
Thank you, everybody. Have a wonderful weekend.
You too.
Thank you, Fred.
Thanks, Claudia.